Welcome home to USA Global TV and Radio, a place where dreams take flight, with authentic storytelling, diverse perspectives and meaningful conversations, where global stories unite and bridges are built beyond all borders. Discover world-class education, entertainment, hope and inspiration. Together, we're building bridges worldwide. Subscribe to our channel, USA Global TV. Download our app, USA Global TV. Be our guest or join our team. Visit usaglobaltv.com. Thanks to our founder and executive producer, Dr. Jacalyn Kerbeck. Music score by Yeffy Tang from Cloud Road Music. Voiceover artist Mike Porter. Creative direction by Paul Garcia. USA Global TV and Radio, your home for global connection. All rights reserved. This video and its contents are the exclusive property of USA Global TV and Radio. Unauthorized use, duplication or redistribution in any form is strictly prohibited.
Hi, Reverend Laughlin here, and today I'm hosting the show This is Floxed, and I'll be introducing Talia Smith very briefly. About me real quickly, I'm a writer, over 1,000 original content articles on LinkedIn, speaker, researcher. I research the human body at the cellular level. Chemically speaking, I look for cause and effect relationships. I also publish books for people. I've published 6 of my own. I'm writing 2 now, and I've done about 50 for other authors. And I host 3 shows here on the USA Global TV and Radio Network every Thursday. That's real quickly about me, but today's show is not about me. Today's show is about Talia. Talia, please join me up here on stage, and I'm going to do a real brief introduction and then turn the show back over to you. Talia's been doing hosting duties here on the USA Global TV and Radio Network for a short time. I think today is number 4, number 5. And she came down, and literally came down, with an interesting life experience that she's going to be sharing. And it's something that's more common than we think. And on top of that, it can be very deadly. It's an extremely emotional trauma that can happen to a small percentage of people, but it happens. And with that, I am just going to turn it over to Talia, and she's going to tell us a little bit about her story, her health journey, and at some point in time, she's going to introduce Dr. Kelly Mccann, who's an expert in a couple of the areas that Talia is going to be talking about today. So take it away, Talia, and I'll be in the background monitoring for questions and comments.
All right. Well, welcome to my 4th episode of This is Floxed on the USA Global TV and Radio Network. This show is dedicated to raising awareness for fluoroquinolone toxicity syndrome, which is also known as being floxed. This means that a person is experiencing the adverse effects of a fluoroquinolone antibiotic like Cipro or levofloxacin and many others. Most people that are floxed develop mast cell activation or Mcas to some degree. This is what has made me so passionate, is that in April 2021, I took a fluoroquinolone antibiotic called ciprofloxacin. Within 3 pills, my 3rd dose, I was in the hospital, unable to walk, and experiencing probably every adverse effect that the FDA has written about fluoroquinolones. Prior to this, I was totally healthy. I was active. I worked out 7 days a week. I had a career. I took care of my husband, who's a disabled veteran. I never had any sensitivities to foods or anything. This was something I was not used to at all. So I became floxed, as I just explained. And about 2 months later is when I started developing what I now know is mast cell activation syndrome. I started becoming what I call allergic to everything, and not able to take supplements that I was taking before, eating foods. And this left me in a really bad situation with the Western medical system, telling me to just eat, but I couldn't eat, and I was having all these reactions. And then unfortunately, 5 months later, after taking those 3 pills, I ended up on hospice at 60 pounds. That's because I had not eaten anything or even drinking water in 4 weeks. I was even reacting to water. And I found a couple of functional medicine practitioners that helped me realize that I had mast cell activation syndrome, which helped me at least start to intake things to help me on my journey of, recovering from being floxed. So in my advocacy, I always talk about fluoroquinolone toxicity and mast cell because there are so many people that have mast cell that don't understand. Like I said, most people that are floxed develop this to some degree. Some people, they're not as sensitive as me. I'm like all the way on the on the other end of mast cell. But what's unfortunate is these folks that are floxed don't always know that mast cell is a separate syndrome that needs to be treated on its own. And in the most severe cases of Mcas, people have very few, if any, foods, supplements, or medications that they can tolerate. Like I said, I was down to 0. On the first episode of This is Floxed, Dr. Pipa explained that Mcas needs to be treated before any kind of floxing protocol. And if that doesn't happen, the body rejects the protocol and the person often gets much sicker, which I've seen over and over, and people reaching out to me, which has also happened to me. This unfortunately leaves the person stuck because they need these foods, supplements, and minerals, but they can't handle them because they have mast cell activation syndrome. So today it's not just for people that are floxed, it's also for people that have or think they have mast cell activation as well. So if you have few foods, medications, or supplements that you can tolerate, if you have many sensitivities to things like sound, light, smells, etc., then today's show is definitely for you. Our special guest, Dr. Jacalyn Mccann, is a leading expert on this topic and will help us navigate the complicated world of Mcas. Dr. Jacalyn Mccann's background is in functional, integrative, and environmental medicine. She's a practicing internal medicine doctor and a pediatrician. She is a world-renowned mast cell expert, and in any summit that has any connection to Mcas, Dr. Kelly is usually a guest or the actual host. And I know this because I've seen them all, and I've been following Dr. Jacalyn Mccann for years. She has a thriving practice at the Spring Center in Costa Mesa, California. She's on the board of directors for multiple professional organizations and also presents at different international and national professional conferences. She has mast cell training courses on her website. Sorry. And she is currently writing a book for patients. Can't wait to see that. Not only does Dr. Jacalyn Mccann have the extensive knowledge and understanding of Mcas, but she also understands sensitive patients like me. And this is very important because people need the compassion that she has when we're in this situation. We're desperate and we need help. So, Dr. Jacalyn Mccann is accepting new patients, and she is licensed to practice medicine in 12 states. So, I think I just said a lot. And if we could bring Dr. Kelly on, that kind of wraps up my introduction. And I just want to say thank you so much for joining us today. I'm so excited. I'm so nervous.
Well, take a couple deep, slow breaths. You're doing great. And I'm really happy to be here.
Yeah, you're going to help a lot of people today. There are so many people with fluoroquinolone toxicity struggling with mast cell, and they're attempting to do these, drastic protocols, and they're just making themselves worse. They can't handle all of these IVs and medications and stuff like that. So I thought it was really important to have you on today. And I think the best way to kick off the show is just for you to explain what is mast cell activation syndrome and what isn't it as well.
Absolutely. So let's start with the mast cells themselves. These are part of our immune system, and they're actually born in the bone marrow. They are related to our red blood cells and our white blood cells. And after they're born in the bone marrow, they move to the areas of periphery where they live for the rest of their days in our bodies. And so these areas include our mucous membranes, things like our nasal passages, our sinuses, mouth, gastrointestinal tract. They live on our skin, Some of them line the blood-brain barrier. There are a few in the brain, not too many, unless we have a leaky blood-brain barrier, which is really common when people have leaky gut and all these sensitivities. They love our nerves, they love our blood vessels. And the reason that they live there is because their job is to fight foreign invaders. So they are part of the first line of defense for the body, and they exist in everyone. They've been around for millennia. They're in a lot of other animals as well. And what they're constantly doing is looking at the environment and surveilling for foreign invaders. And if they see a foreign invader, their job is to release these chemical messengers or mediators into the environment to sound the alarm that there's a danger present and it needs to be addressed. And so it calls in other parts of our immune system to help fight that infection. People often learned about the cytokine storm, which was the body's response to COVID, for example. That was a common comment that people were having an inflammatory reaction to COVID. And what was going on then was the mast cells were what we call degranulating. They were releasing all these chemical messengers and flooding the system with inflammatory mediators, different kinds of cytokines and chemokines, things like histamine, serotonin, heparin. And this response was to that threat, whether it was COVID or a drug or an infection, mold, and we'll talk more about what are the things that drive Mcas. And this is something that, as I said, happens in everyone. But what happens with mast cell activation patients is that the mast cells get trigger happy. They become very hypersensitive and they perceive threats where there are none, like water should not be a threat, right, in general, but the mast cells are misperceiving their environment, misperceiving the danger signals, and releasing all their mediators. And so that's what mast cells are. Mast cell activation syndrome occurs in about, pre-COVID, it was about 17% of the population. Now I actually think it's much higher than that, and certainly among patients who have been floxed, it is much higher than that as well.
Yeah, it's a very hard thing for us, especially that are flocks, to really differentiate, because when you are having a mast cell attack, so to speak, or whatever you want to call it, you're flaring, I don't know the right words. It also feels like floxing times 10. So people are like, is it being floxed? Is it mast cell? Is it both? I mean, I had never even heard of mast cell until so far into my journey. My husband met somebody in a support group that said, hey, I'm floxed. If you want to save your wife's life, stop focusing on being floxed and focus on mast cell activation. And we were like, what is that? He's like, your wife can't even drink water. Trust me, she has mast cell activation. Right. And so focusing on that actually saved my life, because at 60 pounds and on hospice, I didn't have much time left. So could you also explain, like, I get questions all the time now, like, oh, I ate a sweet potato and I get a rash. I think I have mast cell activation syndrome. So can you explain, like, because it's in multiple systems, right? Could you explain like what it is and isn't? Like,
yes. Yeah. So there are two camps of practitioners who supposed to treat mast cell activation patients, and we call them, in consensus one, practitioners. These are usually the conventionally trained allergists and immunologists who have a very, very rigid criteria by which they make the diagnosis of mast cell activation. and they look at symptoms, but they're mostly fixated on tryptase levels. And the idea is that when you're not in a flare, your tryptase level is whatever it is. And then when you are in a flare, your tryptase level is like some percentage times 2, whatever, 20% higher than when you're not in a flare. Now, this sounds a little silly to me. It's also woefully insufficient to identify patients who have mast cell activation. So I'm actually part of Consensus 2, which follows the medical literature written by medical doctors like Dr. Lawrence Afrin, Dr. Thea Herides, who have done extensive study and medical reviews, as well as many original papers on what is mast cell activation. And it really is a clinical diagnosis where people have multiple symptoms in multiple systems of the body. And those symptoms include anything that is allergic, inflammatory, or even growth related, because in addition to these inflammatory mediators that are in the mast cells, there are also enzymes and growth factors. And so people who have mast cells can also make a lot of cysts, they can make a lot of lipomas, they can make a lot of growth in different tissues in the body. And so it's really, mast cell activation is a clinical diagnosis. And yes, clearly, Talia, you had mast cell activation. Oftentimes people will have symptoms in multiple systems. And I would say you probably need at least 5, although there's no strict criteria about how many systems are involved. So if people have fatigue, if they have migraine headaches, if they have gastrointestinal symptoms, if they have cardiac symptoms, if they have genital urinary symptoms, and maybe skin symptoms that are allergic or inflammatory in nature, more often than not, they have mast cell activation. If you have skin reaction after a specific food, or you have hives after food, or even just histamine related foods, there is a condition called histamine intolerance where people have difficulty breaking down histamine. We break down histamine in the GI tract with an enzyme called DAO. And some people have insufficient DAO, and so they will have GI symptoms. They might have skin symptoms, but it's really just related to histamine. And if they avoid histamine, eat a low histamine diet, usually they can improve their symptoms. So those are some of the big differences between the two. You can certainly have allergies and not have Mcas. Seasonal allergies, environmental allergies may not meet the criteria. That person might be more susceptible. So if they have enough other exposures, they might trip themselves into a mast cell activation kind of situation. But that's really the differences. There's Consensus 1. If as a patient you go to see an allergist or an immunologist and they are dismissive, please leave. You will not get the help that you need there, and seek out somebody who has a much broader understanding of more Consensus 2 type diagnoses to help you navigate the diagnoses and then the treatment.
So there's a couple things I just want to stress in what you just said, because there are things that I say to people all the time. And I'm just going to reiterate them because you heard them from Dr. Kelly Mccann herself, okay? So people always come to me and say, I was tested for tryptase, it's negative, they say I don't have mast cell. And unfortunately in the unfortunately in the Western medical system, if that tryptase is negative, that's it. It stops. You do not have mast cell, and nobody wants to hear it again, right? And I keep telling people that reach out to me, it doesn't mean you don't have mast cell. It's an antiquated way of testing for it. maybe it's great for mastocytosis, but not
Yes.
mast cell, right?
Right. And that's the thing too, Talia. It's really interesting. The tryptase level is related to the number of mast cells in the body, not how activated they are. So the fact that consensus one practitioners are using it as a definitive diagnosis is really ludicrous. I have one patient with mastocytosis. His tryptase level was 90, right? Most people's tryptase levels are in the single digits, whether they have mast cell activation or not. So it's not really a close call. And then just for clarification, there is also a hereditary alpha tryptosemia where people do have more copies of tryptase, and so we call it HAT. It is a condition that is similar to, and often, we treat it as if it's mast cell activation because they do have a higher level of tryptase. And they often do have many symptoms that I would diagnose with as being mast cell activation.
Mm-hmm. I keep telling everyone that reaches out to me exactly the word you spoke. I'm so happy to hear it. Consensus 2. I said when I was in the Western medical system and I kept getting negative tryptase and the N-methylhistamine urine test that is frequently done incorrectly, it is not frozen and or refrigerated, whatever. They kept writing inconclusive and bringing my urine down to the lab refrigerated, and they still messed it up. And I tell everybody that reaches out to me, you have to find a practitioner that will diagnose you based on consensus 2. And people are like, what the heck is consensus 2? Trust me, I've had like 6 functional medicine doctors all diagnose me with Mcas using consensus 2. So like you alluded, go ahead.
It's a medical paper that Dr. Afrin was the lead author on, and there are at least 40, myself included, other practitioners who came together to write this consensus. It's free on PubMed. If you Google mast cell activation consensus 2, it will, and Larry Afrin, it will come up.
Yep. And I remember having a discussion with my allergist and immunologist, again on the Western medicine side, and I brought the documentation, this consensus 2, the stuff on tryptase, and I said, can you see this documentation that this is not like the right way to test for mast cell? And she said, yes, I acknowledge it, but unfortunately this is how this institution tests for mast cell activation syndrome. So I knew that was my answer, and I have since then been in the naturopath of functional medicine world to get treated for this, because it's not going to happen in the Western medicine system.
Right.
So
and there are more labs, right? So there are probably a dozen different labs. You can check histamine levels. You can check the N-methylhistamine. There's some prostaglandin E2 markers in urine, leukotriene E4 markers in urine, and yet, if we're looking at like a dozen markers and there are hundreds, if not thousands, of mediators, if we miss it, it doesn't mean that you don't have that diagnosis. I find it valuable for some people to do the testing if people want to, if they have the insurance, and you can get insurance to cover it. The other ways to support the diagnosis would be different kinds of stains on biopsies. So if somebody has a colonoscopy, a bladder biopsy, not skin, but usually colonoscopy, endoscopy, you can get a CD117 stain on those tissues. And if the mast cells are more numerous than 20 per high power field, that can also be a support of the diagnosis. Now, remember, we're talking about numbers of cells, not how they're acting. But we do find that in patients who have mast cell activation, they have a handful more. Maybe people would have 20 or 40 cells per high power field in the different areas of the tissues. That reminds me too, Just there was a paper out of Australia about breast implant illness, which is also associated with mast cell activation, and there were higher numbers of mast cells surrounding the implants in the patients who had breast implant illness. So there is a increase in the number of mast cells as well, just not to the level where you're going to get an elevated tryptase most of the time.
Mm-hmm. And so just to clarify, we have, I don't know, hundreds or thousands of mediators. I'm not sure, but there's only testing for like a dozen, right?
Yeah. If that, and because they're like different variations. So you can check prostaglandin D2 in blood and urine. There are some metabolites of histamine and prostaglandins and leukotrienes that we can look at. We look at chromogranin A, the tryptase, of course, histamine itself. I do find it sometimes. And I think that the other important point that you made is that the specimen have to be chilled or refrigerated. And that includes the tubes, if you're having blood drawn, if they're not refrigerated right away, if the urine is not preserved and refrigerated, then you're gonna miss those mediators. And so any practitioner who might be listening and interested in learning how to test, you have to talk to your pathology departments at your local hospitals to make sure that they have a refrigerated centrifuge and that they know how to handle the specimen properly.
Right. So if you're someone that you have 8 mediators that aren't part of testing, you will never be positive.
Correct.
In the blood testing. So I'm saying that for all the people, and I understand why they're like that. They just want a test that says positive because nobody will pay attention to them otherwise. Nobody in the Western medical system. So I understand that. What test can I take that shows I'm positive? It's not that easy with mast cell activation syndrome. You just have to move the system that you're using to diagnose you. That's always my advice.
Yes.
And I know that people always say to me, like, why can't you just eat? Like they don't like, what happens to you? What would happen if you have a raspberry? Like they don't understand like what it does to you. And I try to explain, like, for me, the way I get mast cell attacks. I don't know.
Flares. You can call them flares.
Yeah. So I currently only have 5 foods that I can eat. And this is 4 years later. I lost a food along the way. And when I have an attack, it is like the flu times 100. My whole body hurts, joint pain. The nerve pain that I experience on a regular basis after taking a fluoroquinolone is like times 1,000. I will get spasms. I get bladder pain right away. Like pain in my bladder, pain urinating. I know right away that's mast cell. Brain fog. Of course, I get rashes and hives all the time, even when I'm not eating stuff. But it's like it takes over my entire body, and you cannot go on your day and be normal. There's no possible way. Like I can't even get up and stand. I have to go to bed. Like the attacks for me, the flares are so bad. So that's why I try to tell people it's not just like eat it and power through it. I can't, and that's how most people that have mast cell are. They can't just like power through eating whatever they want. So it's very difficult too to figure out what are the things you can tolerate. That's very hard, because especially if you are floxed and you're experiencing other symptoms and you're trying new foods, it's like, is this being floxed? Is this mast cell? It took me a really long time to figure out what I could actually tolerate and what was bothering me. But people like Dr. Neil Nathan, Beth O'Hara, they helped me greatly in the beginning of my journey, basically survive. I'm very thankful for them.
Yes.
So outside of being floxed, and long COVID, because everybody's heard about mast cell because of long COVID, what are some other things that trigger mast cell?
I would say the most common things that I see in my practice are mold exposure as a huge, huge trigger, Lyme disease and different kinds of chronic infections, Bartonella, Babesia, kind of the whole tick-borne infections, different environmental chemicals, pesticide exposures. Mast cell activation was only really discussed in the medical literature starting in 2007, but it is not a new condition. People who have multiple chemical sensitivity, who often develop hypersensitivity, it's because of a chemical exposure, pesticide, unknown chemical, heavy metal, and those people's symptoms are very similar to mast cell activation. Dr. Claudia Miller, who is very well known in the multiple chemical sensitivity realm, did a joint paper with Dr. Lawrence Afrin. And so, yeah, chemicals are a huge trigger for mast cell activation, as well as EMF. And, in many people, Talia, I find that it's cumulative, and it's often, I suspect with Phlox patients, it's the straw that broke the camel's back, right? So maybe people have had exposure to different kinds of chronic infections. They might have Lyme disease and not know it. They might be living in a moldy building and not know it. And then what happens is you have some sort of last straw that pushes things over the edge. For people who have long COVID, I see this a great deal. They were not as healthy as they thought they were. Their body burden, so the environmental toxicant exposure plus mold and infections was at the limit of their body's capacity to manage it. And then unfortunately they got COVID, or they took an antibiotic like a fluoroquinolone, and it pushed the mast cells into a super flare. And so oftentimes what happens is when we're trying to get people better, we want to identify what are all the potential triggers or the root causes for causing the mast cells to be so dysfunctional and hypersensitive. And as I mentioned, in many, many of my patients, it's mold. And so when I'm working with somebody, I'm looking not only to help them feel better, of course, right? We want to get the symptoms down. We want to get the nervous system under better control. We want to get the mast cells down, but we also want to identify what are those things. Is it fluoroquinolone toxicity? Is it Bartonella, mast cell activation? I would say in my practice, it's mold and Bartonella. Those are the top two triggers for most of my patients.
Yeah. I was just going to ask something. What do you suggest when a patient, how do I say this politically correct? You have a patient that is experiencing mast cell, and what you're saying is interesting, because I can tell you so many people that are phloxed also have mold and Lyme. It's like this, not even trifecta, quadrifecta.
Yeah, it's a perfect storm. It's a perfect storm
that we get. And I feel like when you're trying to utilize the Western medical system, and we do that because of insurance, because if we don't go that route, oftentimes we have to pay out of pocket, and it's very expensive. But I have found, and I know other people watching too, have found that when you go to these practitioners, and God forbid you talk about Mcas without tryptase, but even worse, you bring up the word mold. I have been laughed at by doctors that it's not a real thing. Lyme disease, I have a positive test. Doctors don't believe it because they didn't order the test. Like it's all this, I don't know, ego or whatever it is. So if a patient is in the situation where they are just like what can they do? Like these doctors don't want to have anything to do with them. They don't believe in mold. Mold's a big one. I haven't had a single doctor that believes in mold in the Western medical system. What can they do? Like just go to see a functional medicine doctor? Or
I think so, really. I mean, in many ways, by trying to work in a system that doesn't believe you, support you, you may be, I mean, you're getting gaslit. You're most likely, right?
Yeah.
And it's worsening your nervous system. It's putting you at odds with somebody who is supposed to help you, and they're not capable of helping you. You know, I learned a long time ago in my residency program, or I had an aha moment in my residency program, that the way conventional medicine works, their structure is, we want to list out the symptoms and we want to come up with a differential diagnosis. And then from the differential diagnosis, we'll do our lab testing and then we'll know what to do. And unfortunately, that's not helpful. Nowhere in that is the question, why? What is it about this person that is unique, that is driving the symptoms that they're having? They don't care. That is not the question that they're asking. The question is, what is the differential diagnosis and how do I make that diagnosis? And if you don't meet the criteria, you're kind of, SOL. So you have to advocate for yourself. If there's one thing that you learn from Talia and myself, is that you will not get help if the help doesn't believe you, right? So you have to, save your money, ask for help from your family and friends if that's what's necessary in order to get the actual medical care that you need, because, doing the same thing over and over again and expecting a different result is not going to be helpful. You have to find somebody who is open and willing to believe you. And, I decided a long time ago that if a patient was going to come in and tell me a story, even if I couldn't understand it, I'm going to believe it, right? Nobody wants what you guys are experiencing. Nobody asked for that. So if people don't believe you, get up and walk out. It is not worth your time. It is not worth the trauma to your already traumatized system to stay in a situation where people don't believe you and won't be able to help you.
Yeah, we definitely have a lot of trauma and are pretty much gaslit every time we go into a Western medicine office. So I say the same thing, like, you just got to get out of that system. I realized that early on, if I wanted to survive, I had to leave that system. And it's the only reason why I'm here today, is because I have, been working with functional and naturopathic medicine doctors who do believe me.
And there's a difference in functional and naturopathic doctors too, in terms of their capacity, right? Beth O'Hara was a master at little teeny tiny sprinkles. And there are a lot of very well-meaning naturopaths and functional medicine doctors who are hearing about mast cell activation and saying, oh yeah, I understand that. I know what to do. Let me give you an H1 blocker. Let me give you cromolyn, ketotifen. And those are great medications. But if you are so sensitive that you're on 5 foods, you can't start at the full dose, right? You need somebody who is going to be able to guide you and tiny sprinkles and help figure out what are the best things for your unique constellation of symptoms, your unique constellation of mast cells, to calm everything down. And the other thing I would say too is that I think about mast cell activation treatment as a 3-legged stool. We have to address the immune system dysfunction, that's the mast cells, but we must also address the nervous system. If you're constantly in fight or flight or stuck in freeze with vagus nerve system dysfunction, autonomic nervous system dysfunction, that must be addressed. If you are limbically activated, which is the ancient part of the brain, the limbic system, right? Where we take our experiences and we turn them into memories. And many times the people who develop mast cell activation syndrome, it's because the nervous system was off. There might have been a trauma in your history, there might have been multiple traumas. There could have been, there could be a high ACE score, adverse childhood events. And these things set up the nervous system to be hypervigilant because that was the environment in which your nervous system was developed. And so it is very, very important to not just focus on the mast cells, but to recognize that your nervous system and your immune system are integrated. And the work of getting better includes not just taking medications and supplements and adjusting your diet. It includes learning how to feel safe in your body, learning how to cultivate that sense of relaxation and safety.
Just to expand upon that, can you talk about, I know we're all different and our causes are different, but how you generally treat patients? Obviously, there's going to be some limbic system work from what you're speaking of, but what are some other things that you're doing to help people with mast cell?
Some of it is, so it really depends on where we're starting, right? And how sensitive people are. And oftentimes I do start with suggesting trying some different supplements or medications. Honestly, I use muscle testing to help guide me because there are hundreds of things that I can give you. And I want, you've been suffering for long enough that I want to get as close as possible to the right combination of things. Some of my more conventional colleagues will have patients try every single H1 blocker, every single H2 blocker, every single medication, and then eventually they'll go to supplements. That works for some people. I have a different philosophy because you've been suffering long enough, and I want people to get as better as soon as possible. So, we try to do the things that seem to be the right ways to go. And then you have to do the nervous system work along with that and simultaneously figure out what are those root causes? Is it mold? If you're in a moldy house and you're still flaring, your mast cells can't calm down. It doesn't matter how many supplements or how much you adjust your diet. You have to get out of the mold. I talked to a woman yesterday who was in LA in the fires, and her nervous system was so on edge because of all of the debris from the fires in LA from January, and there was mold in her home. And now she's moved to a different state, and immediately she could tell that her nervous system had calmed down a great deal. Despite the fact that when she would go outside, there was lots of pollen everywhere, right? Her nervous system wasn't bothered by the pollen in this new state where she was. It was bothered by the mold. It was bothered by the smoke and all of the debris from the fire. So getting out of a situation where you might be constantly being triggered by your environment is super important to begin that healing process. And I think the last thing I would say is that we can see this as a death sentence. We can see this as a terrible thing that's happened to you, or you can see this as an opportunity to really heal, not just the fluoroquinolone toxicity, but all of the things that have occurred in your life that have predisposed you to having those issues in the first place. I had a mast cell patient who had POTS, and when she came to see me, she couldn't sit up. She had to lie down our entire appointment because her heart rate was 120 and she couldn't think because there was no perfusion to her brain. And I saw her last week. She's happily divorced. She is now working full time. She goes to the gym 5 days a week and walks on the treadmill. She's lost 40 pounds. She is unrecognizable. And it wasn't how we treated the mold. It wasn't how we treated the Lyme. It wasn't even how we treated her mast cells or her POTS. It was starting to shift how she perceived herself, that her body was capable. Just like Talia, your body was capable of healing from death's door at 60 pounds, right? There's so much wisdom in the body and in our own intuition when we listen. And I often will tell my patients, who are some of the sickest patients, that they're on the fast track to really embodying their authentic selves. And so there's so much that you can learn from this situation, and so much that you can grow from this situation, even when it feels terrible. And it starts with recognizing that your body isn't actually against you. It's doing everything that it can to protect you. And this is so critically important. Like your body, your thoughts, your brain, your emotions, your spirit, they're all connected. And if there are alarm bells going off in the body, then maybe we should ask why. What is it that is going on? How is it that I'm not, that I could see this from a different perspective? And that would be my message of hope, is that we can heal at all the levels, not just the physical body, the thoughts, the emotions, the beliefs that we have about ourselves, and truly embody our purpose on the planet. You know, your purpose, your drive to help all of these people so that they don't have to suffer like you suffered. That's a huge, important passion for you. And it's transforming your life. It's transforming the lives of so many people. And you never would do that if you hadn't experienced it, right?
Right.
How powerful is that?
Yeah. I just wish I didn't have to suffer so much to do it.
You know, we learn best through adversity. We don't learn when things are easy.
Yeah.
You know? So, and I think that some people sign up for, I mean, I don't know. I believe that we're all here for a purpose. And that I also believe that some people sign up for like the fast track. I don't want to, waste my life learning things on the slow train. I want the bullet train to my authentic self and my purpose on this planet. That's what you signed up for.
Have you, how do I ask this? Does mast cell ever go away, or is this something that's always going to be there to some extent?
I think it can go away. The book that I'm working on is actually a series of patients, 7 of my patients, almost all of them who have had mast cell. Many, the one woman I mentioned who came in and had to lay down on my couch with POTS, and their lives are utterly transformed. They are not the same people that they were before they got sick. So we talk about recovery. I don't actually think that recovery is what we really want. We want transformation. We want lives of purpose and meaning and truth and authenticity. And that's what is possible if we're willing to reframe the way that we see our experience. One of my patients had Lyme and mold and was bipolar and suicidally depressed. And now she is a medical intuitive who has a virtual healing practice. She is amazing at sending healing energy vibrations and intuition, just utterly astounding. Another woman, very similar, had oxalate issues. She had been molested by her grandfather when she was young, had a really challenging pregnancy and birth of her daughter, and she had all sorts of symptoms, all sorts of mast cell symptoms. And again, she is a health coach. She is happy, joyful, able to be a great mom now. And she could barely get off the couch before. So healing is absolutely possible. Transformation is inevitable if you are willing to dive deep and do the work.
So if someone is willing to dive deep and do the work, how do they get there? Is that through trauma therapists, or like what do you recommend to your patients for that part?
It's unique. I think that you have to part of the challenge is that with mast cell activation, with trauma, with feeling terrible, we get almost dissociated from our bodies, and we really can't heal unless we're in our bodies and in alignment, right? So the way that you get there is unique, just like your mast cells are unique, your history is unique. And so it's a slow, steady, first you have to deal with the body. You have to have more comfort. You have to have a little bit of cushion of resilience in the body before you can start to do the inner work. Sometimes it has to start with nervous system work, and do what you're attracted to. If DNRS speaks to you, do DNRS limbic system retraining. If Gupta or Primal Trust speak to you, do that. Take what works and leave the rest. One of my favorite books is by Amy Scher, How to Heal Yourself When No One Else Can. Use it like a workbook. It's fantastic stuff when you're ready for that. If you're still only eating 4 or 5 foods, then we have some more physical work to do. But there can be work on the nervous system. I learned this from my patients. There may be a certain meditation that really resonates with you. There may be a certain device that really resonates with you, or an exercise. It's all about creating that synergistic, your program for healing on all the levels. That's really what I would encourage. And as you start to do that, you start to trust your intuition again. Because oftentimes people have an idea that their intuition is against them, their body is against them, they can't trust themselves. And so these little wins and these choices that, okay, that feels good to me, I'm going to go with that particular program or exercise. And there's a ton of resources out there. Some people want to do neurofeedback. Some people want to do, EMDR. It really depends on each individual person. And the goal is a sense of safety and a sense of alignment with what you're doing and how you're spending every day.
Yeah, so the folks out there that are listening and watching this, many of you that have mast cell, Phloxed, or both have lost your confidence, lost your ability to trust yourself. Maybe you feel like your body has failed you, and there's some anger and grief there. Constantly gaslit by the medical community, and I think that Dr. Mccann's suggestions are very helpful in healing that part of us, because it didn't just happen when we got sick. All that we've experienced along the way is just adding to what may have been there before. And I do think that it's really important to get to the root of that and to try to trust ourselves again. And don't think that, our body sucks now, it let me down, like it's a very hard place to be in. What did he say? Do you think there's a possibility? Oh,
Yes.
Yeah.
Yes, Mark, I do think there's a large percentage of the population that's undiagnosed or misdiagnosed. And that's kind of what we started talking about, was that allergists, the conventional allergists and immunologists, hematologists will not make an appropriate diagnosis. And you need to seek out a functional medicine practitioner, a naturopathic practitioner who are savvy about mast cell activation in order to get that diagnosis. Yeah, like I said, the medical literature says prior to COVID, the statistics were about 17% of the population. It's probably higher, like 25% of the population amongst the population of chronic illness. It's probably closer to 80 or 90%, right? So if you have complex chronic illness, then chances are there's a mast cell component of a sort. It doesn't have to be, it doesn't have to be as severe as Talia, but there is a spectrum of people who have mast cell and who need that mast cell stabilization and nervous system work. And it's not a death sentence. It doesn't have to be like this forever. But it does require, as I've been saying, introspection. It requires work, not just physical, but emotional, psychological, spiritual. And that means the ball's in your court and you have all the power, right? You have the power to heal yourself.
Right. Because right now, many of us feel like we have no power. So this is a great message of hope to all of us. And I want to be respectful of time. I see that we're almost out of time. So do you have anything to add before Red comes back and closes out the show?
Let's see. There's a couple of questions that have come up. I think even amongst the functional medicine community and naturopathic community, people aren't as aware of fluoroquinolone toxicity as we should be. And if it's mast cell activation that you're struggling with, I think you may find that simply finding somebody who is mast cell savvy will help you get to the point where then you can tolerate the fluoroquinolone treatments. So that would be my encouragement, is maybe you don't find somebody who can fix the fluoroquinolone toxicity if there's not somebody locally, but you at least work on the mast cell stabilization part, the nervous system part, that you're much more likely to have access to somebody who can help. And then through that channel, you can find somebody to help with the fluoroquinolone toxicity.
Yeah, I think that's spot on. Yeah.
So I'm okay if we bring Red back on and he can wrap up.
I just want to say thank you so much for taking the time out of your busy schedule to be here today. I really appreciate it. Like I said, I've been watching you and following you for so long. To have you here feels like it's a superstar on the show to me. I know you're like, I'm just Dr. Jacalyn Mccann, but for me, I'm like, oh my God, she joined the show. So thank you. And I know there are people that are probably crying right now that are watching this, and this is helping them greatly. So thank you. I really appreciate it.
You're welcome, Talia. Thank you for the invitation. And thank you, Red.
Thank you, Dr. Kelly. And I took about 2 pages of notes. I need to go back and figure out what my compartment is on the bullet train, because I'm in constant learning mode. But thank you so very much, because you provided some great insights into the fact that there's just so much uniqueness in people. And because of that, it's sometimes very difficult to diagnose just about anything if it has a complex root cause. And when they overlap, it even makes it worse. So anyway, thank you so very much for your time today. Talia, as always, a very intuitive questioning. Obviously, you're bringing a lot from your brain, but also from your heart, and for the others that you communicate with. So I thought today was an exceptionally good show. So Talia, good going on that.
Thank you.
The USA Global TV and Radio Network has many shows. I think they average about 50 or so a month, different ones. And it's the home of the Silver Creator YouTube Award for over 100,000 subscribers. Lots and lots of information. We provide awareness and education in many, many different areas. So please join us when you can. Go to YouTube, look up USA Global TV and Radio Network, and you'll be able to find the next live shows that are out there or any of the archive shows. Again, Dr. Kelly, thank you so very much for your time today. Talia, thank you so very much for
Thank
your
you
time.
too.
And for our audience, this is Floxed ending for today. Take care. Bye, y'all.
Thank you.
Get ready to wear the brand that's changing the world of media. Introducing the official USA Global TV and Radio online store. From our TV show hosts to our incredible global guests, you asked, we delivered. Rep your appearance with pride. Whether you've been on air, hosted a show, or tuned in, we have something just for you. Visit us at usaglobaltvradioshoп.myspreadshop.com and start shopping today. Check back frequently. We're dropping fresh new designs all the time. Showcase your role in our global community. These designs celebrate your voice, your story, your presence. It's more than just merchandise. It's a movement of hope, inspiration, education, and elevated listening. Head to usaglobaltvradioshoп.myspreadshop.com. Your spotlight awaits. USA Global TV and Radio. Elevate your style. Elevate the world.
Thank you, viewers and listeners of USA Global TV and Radio, for joining us today. We're honoured to have your time and attention as part of our global community. At USA Global TV and Radio, we believe in the power of authentic conversations, meaningful connections, and creating a world of possibilities together. Want to be part of something bigger? Join our team of elevated listeners at usaglobaltv.com, a space where your voice matters and your ability to listen transforms relationships. Stay connected with us across all our platforms for thought-provoking discussions, expert insights, and empowering stories. Subscribe to our channels at youtube.com/c/USA-Global-TV. Follow us on social media and explore the endless opportunities we're creating for growth, learning, and inspiration. Together, we're not just broadcasting. We're building bridges and changing lives, one conversation at a time. For inquiries, contact us at info@usaglobaltv.com. Music by Johnny Dyes. Produced by Executive Producer and Director Dr. Jacalyn Kerbeck. Voiceover by Mike Porter. Creative Direction by Paul Garcia. All rights reserved. Copyright 2025. Visit usaglobaltv.com to view our full terms and conditions.